Hi there, Jen. It's so excited to have you today. We are the nurse coach duo, and I am going to interview my partner in crime here, Jen. Hi, how are you?
Hi.
Um, we're so excited to launch this YouTube channel and get, people on here and to talk about midlife, perimenopause, menopause. And but today we're going to start with my co-host here. But let me introduce her real quick. So excited to introduce you. Jen is a nurse of 25 years and wife, youngest of four sisters, which I think is super cool. Lots of hormones have been around you for a very long time. A dog mom, and she loves to be active. Her favorite thing is to swim, although she hikes and moves most days, and seems to really enjoy that. So we'll talk a little bit more about that later. And also a menopause warrior. That's how I'm introduced, and that's how I'll introduce her as well, because she certainly is. So I was thrilled to meet Jen at the Integrative Nurse Coach Academy conference last year, and we have had a budding partnership and support system since then, as we have both launched our nurse coach businesses May, June of last year. So we've been on the same path, and I know wouldn't have been here where I am today without Jen. And we're super excited now here to be the nurse coach duo talking about midlife and nurse coaching as well. So you're going to see lots of stuff on this channel about what a nurse coach is as well and what we do for our clients. So Jen, empowers me, has empowered many women, her clients that she works with, and I feel like is super creative in her work and spends a lot of time thinking and again creating really unique content for women in midlife and for her clients. So super excited to dive into her story a little bit more and learn about her and where she's at in her journey as a nurse coach and a woman in midlife. So, are you ready to get started?
Yeah, let's do it.
Okay. All right. So, what inspired you to become a nurse coach? I know this is the first question you asked me, but I think it's really important. So, I'm going to start here.
Yeah, I gotta lay the groundwork, right? Yeah, so I just feel like as a nurse, I've spent most of my life coaching already, right?
Mhm.
As we take care of people at the bedside, whether, they're going home or they're at the hospital, we're already coaching them into giving them better lifestyle choices, helping them get over whatever the ailment is that they have there. So I feel like I was already doing that. Then I got really I'm very into working out and going to the gym, and I found myself like starting to coach my friends on how to do different things and how to eat better and I just really, really like helping people understand that it doesn't have to be so hard, how to do the things that our bodies need. And then I started learning about, health coaching and that type of thing. And when I found out that you could do it under your nursing degree and your nursing license, that was huge for me because I wasn't looking to give up my nursing career. I love being a nurse. I identify as, being a nurse. And so being able to combine those two was really an attractive thing for me to say, yes, this is the way I'm going to become a health and wellness coach is becoming a nurse coach that coaches health and wellness. So that's kind of the journey and why I chose to go nurse coaching versus maybe one of the other certifications.
Yeah, I mean, as we know that there's just so many different coaches out there, right? And we're all trying to do the same thing, is to help people. And I think that's one thing we always have agreed on is um, is continuing to be a nurse first in a sense, and because we bring all this experience to our clients, right?
Yes.
Over you have 25 years, I have 30, and gosh, to even put that into words of what we've done, what we've experienced,
Yeah.
and we want to bring that to our clients. And I feel the same way about and being very, very proud to be a nurse and a nurse coach. So,
Yeah, for sure.
so why did you decide to kind of go down the path of women's health and menopause?
Yeah, so I mean, I got to be around 38 years old and this and through a course of a couple different things ended up needing to get off birth control and realized I know nothing about my body and how it works and how it functions in a sex hormone way. In school, we learned all these other things. We learned, endocrine system, the cardiac system, the neuro system, everything head to toe. But we really
Yeah.
did not dive into sex hormones. And
Mhm.
here I am for the first time in 20 years, experiencing all the ups and downs of like a true cycle. And I started digging in because I didn't really know what was going on and why I was feeling certain ways. And I kept recognizing that I was feeling different ways at different times. And so I learned all about my cycle. And then 38 years old, a few years to learn about your cycle. Guess what? Now it's changing. And I was
Mhm.
starting to hit perimenopause and having all these different symptoms and like, what is this? And again,
Mhm.
not something we learned. So I just really started digging into that and thought, God, we really were done a disservice in our education to not be taught what happens in our bodies. And my whole life, PMS was just something you dealt with. You don't talk about it. You deal with it, you take a Midol or whatever, and you're done. That's what it is. And I come from a family where my mother is a very strong woman, and she's just, and not that you're not strong if you talk about it, because I'm obviously here doing it, but I'm just saying, like, she's just very much like, it's just not something we
Mhm.
talked about. So, as I'm starting to learn all these things, I'm thinking, other people should know this. Other people need to learn this, and not just after we've gone through it. Like to know that it's coming and to know that they have a choice and that, what birth control really does in your body and that you have a choice, but at least you get to know what is happening and you get to choose, okay, yes, I want to go on birth control. And it's a totally fine. I don't care whether you go on it or you don't go on it, but you should know what's happening to your body when you decide to go on it. And that's just one of anything, I think that way with all medications, but I feel like that is not how we are, or not taught that way. Our physicians aren't taught that way. And I just wanted to bring what I've learned and share it with as many people as I can. And I think that if we considered a woman's cycle in any way that we're approaching her health, we could make a huge difference in getting them healthier and making it obtainable instead of just saying, here's a pill for that, or
Mhm.
it just has to be this way. Because that I absolutely 100% do not accept. It just has to be that way.
Right. Or kind of just get on with it, right? Like,
Right.
right. Just
Yeah, which
power
is what
through,
we learned. And I mean, as an
suck it
athlete,
up.
yeah, sorry, yeah, and as an athlete, that was no pain, no gain. Like you just dealt with it. Like, and I was so that's how, and I think women very much just are like, oh well, this is just how it's got to be. So, and we just move on. And nurses are even worse at it.
Right. Right.
So it's like it got this like triple whammy and it's like, okay, it doesn't have to be that way. And I can actually go against the status quo and feel better, which is pretty cool.
Mhm. I mean, it's, out there in the world and being talked about a lot about how medical providers they don't get the education around menopause or midlife menopause. And, what they say is like what 30 minutes or an hour of their residency is
Right.
put towards menopause. And I have to say that going through nursing school 30 years ago, I don't even know. I didn't get that education too. So it just reminds me, of what we need to do. And another, I think, mission of ours, even with our YouTube channel, is we hope we get nurses on here too. I mean, nurses can help women pinpoint these symptoms or bring it to the differential diagnosis of, wow, maybe this is something perimenopausal. So, nurses can be such advocates, in the hospital, in clinics,
Yeah.
and as well, where if you're working with women in midlife. So we are here to educate, right? And coach too. But
That's right.
yeah, so well, thanks for sharing all that. Is there anything else that you would want to share about your sort of health journey or in this time of life that, I mean, you shared quite a bit and thank you for that.
Yeah.
Anything else that you would want to share?
I think just, I already kind of said like it doesn't have to be that way, but like um talking about it has probably been the best thing that I have done. And like my husband knows more about the period and menopause than most husbands because we talk about it and it has made all of any symptom that I have, it makes it easier for me to manage because I understand it and I've talked to somebody. And so like if I tell my husband this is how I'm feeling that day, he's not going to take things as sensitively. Or if I recognize, oh, I feel flat or I feel horrible, whatever, and I can look at my cycle and be like, oh, okay, this makes sense. And just that part of it of like making sense out of it and being able to talk about it makes it so much more manageable and being able to accept like how I'm feeling.
Right, right. Yeah, it's so important. I mean, just that whole component of being aware and, it gets a bit trickier, right? Around, when you're in that later stage of perimenopause, when the cycle is completely changed and
Each
emotions
day's
are
different.
low.
Yes.
Yeah. Yeah. So we'll talk about that another time.
Yeah.
So, what, like, when you talk about symptoms, what is like the most unique symptom that you have ever heard about, from a client or a sister or a colleague or, another woman that you have encountered, which I know
Yeah.
that you.
I will go with the one that, well, there's probably two that like shocked me the most, but the one that probably is a worrisome one, and like it is like the atrophy that happens in your vagina that, you start to have pain, your skin cuts and you can get fissures in it, that sex can become painful, that all of these different things that happen, like yet you have and no one is talking about it. Like, I mean, I guess I can't say no one, right? We've got doctors out there. Like, if you're in the right realm, people are talking about. But like, even in your friends groups, nobody's really willing yet to say it. And I have a friend who actually opened up about it, which I thought, and I learned so much I didn't know about it. And so that was one of the things where I was just like, when Kelly Casperson said like you need to do skincare to your vagina, I was like, holy crap, who knew? It's just crazy. Like the things that you start having to think about and never would have known. And that is the problem, is that people are figuring it out after the problem's already happened. We need to know it's coming. And in America, we're not great at preventative care, but if you start painting the picture well enough, we're gonna go, oh hell, I don't want that.
Mhm.
Um, but then the other one, and just because, and I know I was only asked for one, but the other one I'm shocked at is, and I can't remember the stat, but the fact that like a large amount of postmenopausal women lose a tooth, like
Oh,
keep your teeth, people, like do what we can, like who would have thought that that was part of it? So like, and then I start to think about how many people I do see, how many women that are, in past their 60s or late 50s, and that they're missing like one of their side teeth. And I'm like, oh my gosh, maybe that's why. Um, yeah, it just was a shocking one for me. I had no idea.
yeah. That was one of a conversation that came out of the M Factor,
Yes.
the documentary, because they do a segment and they have a dentist in the documentary, which I think was great for women to hear. But I have two of my friends were talking about, they like turned to each other in the movie and was like, I've lost two teeth. And the other person was like, I've lost one. And
Oh my
like, but
gosh.
not talked about it
Yeah.
prior to that. But to your point of, let's start talking about it. Let's reduce this, the stigma around perimenopause and
Yes.
menopause. And it's just so important for women to continue to talk and support one another.
Yeah.
So I like to say is like, it's easy to talk about hot flashes, right? And like, you know, but it's not easy to talk about, vaginal dryness or if,
Right.
you're having painful sex. And you hope you can talk to your provider about it. If you have, and if you can't, then, it might be time to find a new provider. But I also think to initiate that conversation with your provider is really important too, because
Yeah.
we'll talk about that too, but just like the time that we have our providers is so limited, and to really, advocate for ourselves is so important. So, but
Yeah.
that's still going down another path that we'll do
Yeah.
another day. So, um, let's talk a little bit about your business that you're doing. So
Sure.
you have opened up your own practice, and launched it, as I said before, around in May of 2024. How did you come up with the name of your business? People spend a lot of time, they hire people, they don't hire people, they, really, how did you come up with clarity? How did you, or right there?
Yeah.
Yeah, tell us a little bit about that.
Yeah. So I was obviously learning so much, like I said, like as I was going through this, figuring out what's going on in my body. And I was just amazed at like, the clarity that I found in that education, the clarity that I found in how I wanted to live my life,
Mm,
and setting boundaries and just making decisions on how I wanted to be for myself, not for others. And then, so that there was a lot just overarching clarity. And then I thought to myself, I'm like, I'm not having a midlife crisis, which when at 48, when you decide to start your own business and quit your corporate job or lose your corporate job or however it goes, people are like, oh, is she having a midlife crisis? It's like, no, I have midlife clarity. I know what I want for myself
love
in my
that.
life and in my future. And this is not a crisis. This is 100% clear on what I want to do and what I should be doing and what I'm meant to do. And coaching people and helping them with their health and wellness is just where I've always struggled with figuring out like, oh, what's my passion? What's my passion? And it's like, wait, no, how did I not even see this? Of course, that's been my passion the whole time. I just never called it that. And
Mhm.
it's like, and they tell you to find your passion and do that. And so yeah, it was just constant clarity that I was experiencing, and I want to give that to people as well. So it was a combination of what I had found and what I wanted to provide.
Yeah, that's so awesome. That's so great. I love that you shared how your friends, like you started to coach your friends. And I think the biggest compliment anyone could ever have is really your friends coming to ask for advice and
Yeah.
ending up sort of coaching them. You are a natural, Jen. You're a
Thanks.
total natural. So that's
Thank me.
exciting. What is when you coach your clients, what do you feel is your most favorite topic, I guess? I mean, we start as nurse coaches, we start with our clients where they are, right?
Yeah. Yep.
And move forward at their pace, and as partners and keeping people accountable. But if we have our pick, like, where do you like to start? What's your favorite topic that you like to, I mean, in midlife? Yeah, what's your favorite topic?
I mean, cycle. No, no question about it. It doesn't matter what we are talking about. At some point, I'm probably going to ask you where you are in your cycle. Because each time that I talk to you, if you're cycling, if you're still cycling naturally, and, even in perimenopause, we're still cycling, we may have breaks in it, just depends. And I need to know that. So I know what's going on with you that time that we're talking. And like a really great example would be like I've coached several people that I can tell the difference in how they're acting during the session, that they've switched, that they're in a different phase. And obviously, if it's week to week, you're like, duh, of course it's a different phase. Yeah, everybody, but I mean, like, if it's month to month, even, I can tell, like, typically what phase they're in by how they're communicating, by how they're answering questions that maybe even I've asked before, or they're, they feel stressed about something that they were excited about at a different time. And to be able to translate that to them is
Mhm.
huge, because then they can start to recognize it, and then they can start to see, you know what, you're right. It's about a week before I start my period that I just have nothing in the tank anymore. And I still go to the gym and I still hit it hard because I'm just being a wimp. And it's like, no, your body is shifting down, your hormones are changing, and you need to give yourself a rest day. And you need to be able to give that to yourself, or it's, my cycle day 3, and I have to go give this huge presentation. And, we're not typically very verbal in that time. It's really our kind of like turn inside ourselves, be home and, curled up with a blanket type of a time. But you don't get that choice, right? So I can say, all right, well, let's work on how do we support your body and support your mind so that you are ready when you have to go do that, and then what you do after to then give yourself that break afterwards so that you can kind of tweak how you're managing yourself with those according to your cycle. And it sounds super complicated, whenever you just sit there and you talk about it, but as you start to just learn it and feel it, and you just like
Mhm.
literally, I will know by what I eat that day. I'm like, I'm craving X, Y, and I don't mean like cookies and candy and all that kind of stuff. Like, I'm craving broth today because my stomach is telling me that I'm close enough to my cycle that it can't handle a heavy breakfast. It's things like that. And so it's just a really cool way to just approach your workouts, what you're eating, and what you're doing with your workday and your headspace.
Yeah, no, that's you. I feel like you've taught me so much about the cycle. And so really I should call you a cycle expert. But we'll get more into that, I think, in different different YouTube times together as we interview, other experts.
Yeah.
And I think it's fascinating. What is your the reference that you give to people? Like, is it meaning like written reference, or who's your favorite
Oh.
guru? Or do
Well,
you have one?
I have a girl crush on Stacy Sims. She's my
Okay.
favorite if we're talking about workouts. Well, I mean, she's hitting everything anymore, but she's definitely, like who I would tell you to go to if you're trying to figure out what to do to get in the gym.
Mhm.
So she's definitely my favorite there. Elisa Vitti is who I've learned everything about the cycle syncing, and she has a great app that I send people to learn how to cycle sync.
Mhm.
And then I hope this is what you meant because I'm just like name dropping. But Casey Means and her new book, Good Energy, is one of the best books I've read and is, I think, a must read for anyone who wants to be healthy. So those are
I love.
my main references that I use when I like if I need to go look something up and I'm coaching.
Mhm.
Like those are probably going to be my first three that I would go to because I have books by all three of them. And I think that what I love is it's evidence based.
Mhm.
It is it's practiced and shown to be effective. And it is it to me it's holistic in so many ways beyond the fact that it's touching every pillar that all four pillars and making sure that we're approaching our health in a holistic way.
That's awesome. I think it's important to have your go-to people, right? Because in this day and age, there's just so much out there. And, finding people that you trust and can learn from and, that fill your cup, right?
Yes.
I had just read about the Good Energy book, actually.
Oh,
I need to get my hands on that.
yes. We should
And then
do like
someone,
a book review if you when you read it.
oh, okay, I'd love that. All
Yeah.
right. To be to be
That's
continued.
right.
To be continued. But all right. So is there anything else that you want to tell our subscribers, and why would someone want to tell a friend or a colleague about us, Jen?
Oh, well, I mean, just watch one of these videos and you'll see. But so what do I just, I think Angie, you and I both are obviously is super passionate about women's health, super passionate about getting the word out and helping people live healthy lives and take the hard out of it. It is not an easy button. I don't, but it's doesn't have to be as hard as it is. I think that that is our goal with these YouTubes is to not just show that, but also give resources.
Mhm.
Obviously, we are a resource. We have the information, and we can help you put it into action. But I think it's finding the other resources that people need because we also have our boundaries, right? And we know
Absolutely.
what we can and cannot do as far as like we're not therapists. So we may need to move on to a therapist whenever we get into marital issues or trauma or something like that. We can certainly work with taking what the therapist tells you and help you put that into action, but we
Mhm.
are not therapists. I'm not a pelvic health therapist either, so I can't tell you how to. I've done it. I know the exercises, but I am
Mhm.
going to go send you to those resources. So I think that that's also a lot of it is that, we want to get you the resources that you need to feel better and know that there is help out there. That's probably the biggest message I want to extend whenever we're doing these things is that there is help. Um, and if it's not us, there's somebody out there and we're going to get you to that person because it doesn't have to be us. We would love it if it was us. We love doing this and that's, we would love to work with anybody, but if it's not us, that's okay. We just want you to get the help that you need.
Yeah. Love that. Love that. So I actually am out of Chicago. I live in a suburb just west of Chicago called Oak Park. And Jen, tell us where you are.
I'm in Hazelwood in St. Louis, Missouri. It's uh, just about 30 minutes out of St. Louis.
Well, this has been so great. Thank you so much, Jen, for spending the time and sharing all that you shared today. And we look forward to I look forward to more time with you. We look forward to having you subscribe and follow along with us. And, our plans are, as Jen mentioned, I did earlier, is like we're having nurse coaches on, and really to get the idea of what nurse coaching is doing out in this country. And, there's not many of us. And so we're constantly sharing about who we are and what we do. And then, of course, as we talk about midlife, perimenopause, menopause, all things that, we're super excited to continue the conversation with you. And so please subscribe and we'll see you next time. And thank you so much, Jen. Again,
Thank
we'll
you,
see you
Angie.
soon.
Bye.
All right, Jen, a few more minutes with me here. We're going to
Okay.
do our little rapid fire just so we can get to know you that much more than we know now. But all right, here we go.
All
10
right.
different things. First one is coffee or tea?
Tea, caffeine free.
Ooh, okay. Cats or dogs?
Dogs, 100% dogs.
Ah, okay.
No question.
Cookie or cake?
Oh, cookie.
It's on your mind today, isn't
Yeah, I'm ready for a cookie.
it? I think you should have one.
I
Okay.
think I will.
Comedy or horror?
Oh, comedy. Oh, I hate horror. Makes me
Yeah.
jump out. I mean, I jump out of my seat when somebody just like comes through the door fast. So,
Favorite self-practice?
oh, the Herkel Durkle. Do you know what that is?
No?
The Herkel Durkle is whenever you lay in bed awake. So you wake up and you just lay there as long as you want to lay there and just enjoy being in bed and awake and not rush right into the day. I do that every Saturday. A Herkel Durkle.
And how long does Herkel Durkle last? Or
However
is
long
just
you want
go,
it to. Usually until I can't, I have to pee. Till I can't
love
hold
that.
it any longer. But yeah, just however long you want to. Sometimes I go in and get right back in bed after I go to the bathroom and
Oh,
just
there you
whatever I feel like. My dog usually lets me know it's time to get up.
All right. Favorite go to for a quick energy boost?
Oh, I love the breathe and bounce. Just like if I can't get like a true walk in or something, or I'll just get up and stand up and bounce up and down and take 3 deep breaths while I'm bouncing up and down. And it's amazing the energy that you can get out of that. But I have a treadmill in my office, so a lot of times I'll just jump on that or do some push-ups. So dumb.
I love that. That's great. That's
But
great.
yeah, it's better to me,
Um,
it's better than anything else, any caffeine or anything that I can take.
yeah. What is one thing that you wish you would have known before entering midlife?
Boundaries. I love
Okay.
my boundaries now, and I wish that I would have had them for my whole life. I am a giver, a people pleaser. Like, I mean, we're nurses. We rarely
Yeah.
have boundaries, because we just want to take care of everybody. So, and I still struggle with that, but I have learned to set certain boundaries that I don't let go of. I'm not perfect at them, but I do like them.
Yeah, it's awesome. All right, one last thing. What's one thing you have given up as you've entered the change or in this perimenopausal, menopausal transition?
Oh, given up. I have given up perfection. I've always, as far as like, if I'm gonna do this diet, I'm gonna do it 100%. If I'm gonna do this workout, I'm gonna do it 100%. I have definitely allowed the 80/20, embraced it, and it makes life so much better.
Yeah, I love the 80/20.
Yeah.
We'll talk more about that.
Yeah. Love it.
Yeah. All right. Good job.
Awesome. Thanks.
Thank you.